And let's get going. So hi everyone, welcome to our webinar today. We're going to be talking about period changes in perimenopause. And we are joined by EJ Kim, who's my co-founder, and Dr. Margo Harrison. Hi, Dr. Harrison. We're going to properly introduce you in a minute, but very happy to have you with us today. So really a very quick intro on who we are. We're NABI. We are a perimenopause startup. We're focused on perimenopause, and we are really on a mission to redefine and change the way women go through perimenopause through this specific stage of their lives. And we really are focusing on leading with education. And this is the reason why we're doing these webinars very often, just getting on a Zoom call with people that we've had conversations before that we're very inspired by, and that we feel that they have incredible information and education to share with our larger community. So this is the reason that we're here today. And really, before we dive into interviewing Dr. Harrison, I want to just make a quick reminder that we will be recording this session, and that any questions that you have, please drop them on the chat, or just come on camera and ask your question. But really, we want to make sure that if you have any questions, that you leave this session with those questions answered. And of course, just a brief disclaimer about how what we're sharing with you guys today is not medical advice, is educational purposes only, and that you should be speaking with your doctor if you have any specific questions. So I'll leave it to you, EJ, if you want to introduce Margo and take it from here.
Awesome. Yeah. All right. So let me please introduce Dr. Margo. So I'll do a little intro, but please, Dr. Harrison, you can chime in afterwards. So Dr. Harrison is an obstetrician, gynecologist who trained at Columbia. She became an NIH-funded PI at the University of Colorado. Woohoo, loved it. And has now spent the past 3 years working in femtech and providing care at Planned Parenthood of Rocky Mountains. She recently founded and is launching Wave By, which is a women's health company that exists to reduce period pain and bleeding, thereby giving women 7 years of their life back, which I thought was fascinating. They are currently lost due to poor period pain control. So welcome, Dr. Harrison. So love to have you. Yeah. So let's just get in. Why do we have periods? It's really starting very fundamental, but why do we have periods? But of course, because we are, likely women in peri, so we kind of know why, but like we love that fundamental knowledge there, insight. But then how does our period change in perimenopause?
Yeah, so these are, amazing fundamental questions. And I think what's so important about women's health in general, and why you guys and why I am starting a company, is because there's a lot of fundamental questions that are not actually very well answered with respect to women's healthcare, women's issues, and the changes over the course of the reproductive life cycle. So I do have sort of a presentation to answer some of the questions I'd love to get into, but just want to say thank you so much for the opportunity to be here and to connect with you guys. I met EJ at a conference in person, which is, nobody meets each other in person first these days, but EJ has been a mentor to me so far in this startup world. I'm super excited about NABI and what you guys are doing, and grateful to, have a connection with you through this crazy startup world, and, this education that we are all trying to do to help women feel better about themselves, empower themselves, and live the life that they want to live. So I'd love to get into it a little bit with you. Again, yes, I'm an OBGYN. I am still clinically active. I'm founder and CEO of Wave By Inc., which, as you said, exists to enable women to fulfill their human potential by giving them their time back. The period to me is really an obstacle to women's liberty. I see period pain and bleeding as important issues, but more than that, like you pointed out, I really see it as an issue surrounding lost time, that women could be doing other things that they want to be doing. So I think, why do we have our period? Like, the most fundamental answer to that is just reproduction. We have our period so that we can reproduce. It is an incredibly complex system that exists to basically not have to keep your body in a constant state of receptiveness to pregnancy. It's exhausting for your body to do what it needs to do to be able to support a pregnancy. It's very energy intensive. As you know, when the hormones change and things change, like, it just doesn't feel good going through that process. But if you were in that sort of holding state at all times, I think it would not be very efficient for the human body. So I think just going through some basic concepts here are going to set us up for maybe some deeper questions. But I think the very most important assumption here is that the eggs talk to the brain. So you have ovaries, you have tubes that connects the ovaries to the uterus. The uterus is where the pregnancy is usually implants. The uterus is meant to grow and develop with an implanted pregnancy. But the beautiful orchestra of the menstrual cycle exists or occurs between the ovaries and the brain. So there are hormone messengers that the brain sends out. The ovaries are listening, receiving, and behaving in response to the brain. So this very complex thing, just ignore all the words and just look at the colors here. So these are hormones from the brain. These are messages that the hormones are sending out to the ovaries. And inside the ovaries are the eggs. And so the eggs are getting those signals and starting to feed back a conversation. So the eggs are getting ready. They're basically, it's an entire elementary school still full of students with 1 million different classrooms. And the principal's calling out over the loudspeaker saying, I need the best student to come up to the front right away. And she's sending out this signal, and some of the students know that they're the best, and they're standing up and they are listening to her. And then one of them really hears her and believes they're the best and goes up to the front. So this whole first half of the cycle is the brain saying, give me the best. And the ovaries saying, okay, we've got a lot. We're going to give you a cohort, and it's going to be a bit of survival of the fittest. We're going to take one of the elementary school classrooms, and we're going to tell the kids, whoever gets this math problem right gets to go up to the front office. And so they're sort of working on it, fighting each other, who does it the fastest. And then the principal says, okay, who got the answer? And they look and see who got the answer, and that kid gets to go up to the principal's office. So the first half of the cycle is the ovaries recruiting a cohort of eggs, a classroom of students, testing them, talking to them, giving them challenges, feeding back and forth with them. And then one of them is going to stand out as the best student. And that's in preparation for ovulation. And then the second half of the cycle is really around making sure that the whole system is ready in case that ovulated egg gets fertilized and implants. And so what you need to take away from this is the brain is sending messages, and the ovary is receiving those messages and doing what it's supposed to do. So do you guys have any questions about that before I move on to the next concept?
I feel very smart.
Very beautifully. Thank you.
Okay, so number one concept that everyone needs to understand, your ovary is a bag of marbles, and the marbles in there are talking to the brain. Okay? So this is first, like, what's normal cycling.
Yeah.
And so this is just to give you a sense of, like, everybody always wants to know what's normal. I find the most frustrating thing about this, and to your question, EJ, this is not very, like, scientific to me.
Mm-hmm.
And this right here, this slide, in my opinion, points out what's wrong with women's health. Oh, it's 8 days, 7 days versus 9 days versus, it's not really helpful. Look at this, flow volume. What's normal? What the patient considers normal. I mean, it's like super, super frustrating. And so this is a point where like, it would be great, in my opinion, to define these things by these parameters that we're already measuring. So like, what would be the objective measures of things that would be much more helpful? Marina was asking me sort of, general questions about this kind of stuff. And it's like, oh, well, Marina, what do you consider normal? Now, that being said, it is the most valuable thing that you can do as a human being in general who wants to interact with the healthcare system is actually be able to answer what's normal for yourself. And that, I think, is where people can really fight gaslighting, is they can say, look, what's normal for me is that I bleed for 3 weeks out of the month and I get clots and I lay on the couch and I have to take, ibuprofen 4 times a day. And that is data, right? And then you can go and say, you want to hear what's normal for me? I use 15 tampons in 1 day. And the doctor can be like, okay, that's not actually, that's too many. Or like, let's see what your hemoglobin is. You know what I mean? So these parameters I find frustrating is my first comment about that. But my second comment about it is get to know yourself. Marina was sort of talking about like, once you know what's normal, it can be frustrating to go into perimenopause because it's no longer normal. Well, when things are normal and you do have a sense of normal, you need to benchmark that, especially so that you can then go into whoever you're going to talk to and say, this was what's normal. And my new normal is that I don't really know when it's coming. And like, is that a problem? Is that not a problem? Like, help me understand this thing that's happening to me. So that's the second sort of assumption. Do you guys want to get into any pieces of this?
My question on the abnormal. So should we understand abnormal as the new norm or abnormal as bad? Like, can we tell good versus bad change in our period?
Yeah, that's a great question. So let's come back to that one because there is a normal for perimenopause, which is abnormal. Abnormal is the normal.
You're right.
But that being said, there still can be pathology involved, and you don't want to miss pathology. So let's go through what the normal process is and what happens to you in perimenopause so you get a sense of like what that looks like. And then I think in there we can sort of point out like what would be worth looking into further.
Great.
Okay. So I want to go back to this. Eggs are talking to your brain. You have a bag of marbles, right? And you're slowly letting out the marbles month by month by month by month. If you let the marbles out that talk to the brain, every time you let a marble out, there's less time to there's less marbles talking to the brain, right? So you have the most eggs, you have the most marbles in your bag when you're inside your mom's uterus. You have, like, I just was reading, but putting this together, some study said that there were 7 million eggs in the fetal ovary, and it started to go down about 5 months of gestational age. So when you are in utero, you have a fantastic amount of fish roe in your ovaries. But all the time, like the entire elementary school has 500 students in it. Every month we're recruiting the whole first grade, which has 60 students in it, and 1 student comes out. So every month we're taking a whole grade and we're testing them and we're testing them and we're testing them. And so when things are normal, Marina, is when you're here. You got enough eggs sending enough signal and talking to the brain with enough force that everything is okay. And then your bag gets down to like 15 marbles. And that's when there's not enough eggs to talk loudly enough to keep it normal. So it becomes like, well, who's left in your 4th grade class? Like who's left after you recruited all these students? Well, you got 1 really smart student. You got 1 student who's way behind. No other school would take them. So like you've got these 15 students left, or you've got this bag of marbles left, and those marbles might be really great, or they might be not so great at talking to the teacher. And so the amount is not enough to start to sustain, to continue to sustain that cycle. And you can see that there's just a precipitous drop. And so this is perimenopause on the way to menopause. And I think the best way to think about it is like you lost your marbles. Like your eggs talk to your brain and now they're not there anymore. Or there's not enough of them to continue the conversation well. And then things just get dysfunctional. They're just not as efficient.
I love that because it's literal and metaphorically, you lost your marbles.
Mhm.
Because emotionally you're there as well. But this is fascinating. And just seeing this in a chart, it really helps to bring that to life.
Yep. And I think this one is, again, don't worry about anything. Don't even look at it. Like all you need to know is like normal is red and blue is abnormal. And you can just, blue is perimenopause. And all you need to see here between the two is that they're different. And that basically over time, these signals just become deranged or less efficient. And so like, the peak may be too high. The peak may not be high enough. You may be producing way too much, so it's more just like I this is totally unrelated, but like I have a hypothesis that like in my own body, when I'm eating food, my like satiety signals are less efficient than they used to be. Because like, things are just less efficient. You're just not sending out the messages as well, and you're not receiving the messages as well. And that sort of goes for everything, let alone your reproductive health system. So yes, this is the same concept again. And then I think this slide is the question that you guys really sort of keep asking. And it is, I want to just say all of this data comes from UpToDate, which is basically a database of medical literature that's been compiled so that doctors can go look up topics and like easily get the most up-to-date literature. So I can't take, this is all other people's work and compiled by UpToDate. So that's where I got all this stuff. But like, this to me is the best attempt. When I was talking to you before and I showed you the other slide and I was annoyed because I was like, this is ridiculous. Like what days is not helpful. This is like trying as best as it can to tell us a little bit more specifically, like what's happening, what's the terminology and what's happening. So this stage is your reproductive life cycle. And it doesn't really have puberty in here, but puberty is like the inefficient ramping up, and perimenopause is the inefficient ramping down. So to me, I think of perimenopause as the anti-puberty. But this is sort of the reproductive, and then they have this menopausal transition, which they call perimenopause, and there's early and late, and then there's, post-menopause. And so this is trying to tell you a little bit more objectively how long these things take. So how long you have a reproductive life cycle depends on you and your genetics and everything else. How long is your menopausal transition? Well, it's variable how long you're in this early phase, and then you sort of tinkering along until you get to, post-menopause. So they have these like different stages, and it's sort of helpful, but like, look, this box is empty. So it's like, if you can't fill out the boxes, I'm not sure that having 1A, 1B, and 1C is that helpful. But this is sort of the principal criteria. And you're early as you're getting your period, it's variable. Then you get really regular. And then Marina, this is what you were talking about. You start to see subtle changes in flow and strength and variable length. So they had said on that normal slide, like 7 to 9 days is normal. So it's really like once you had some regularity, whatever that regularity was, once you start to see it become less regular, you're kind of in the perimenopause. Now, I will say, as a perimenopausal person myself, the way that I knew I was in perimenopause was my birth control pills became too strong. Like I could feel they were like, for example, just knocking out my sex drive. And so I had to lower the amount of hormone that kept me feeling like myself. And so I don't get my period because also when I was on the pill-free week of the birth control, I started getting horrific migraines, which I'd never had before. But it was like my body just couldn't do that hormonal change the way that it used to be able to do the hormonal change. And so I started taking birth control pills continuously just to avoid the entire experience altogether. So that's kind of how you might be able to tell is that things change in terms of your sexual and reproductive health, that if you're in tune with your body, and again, if you know it's regular for you and it starts to become different, then and you're around 35 to 50, you're probably in perimenopause. So those are some of the definitions. And then like antral follicle count in the context of infertility, people may have heard about this, but antral follicle count is basically if you put in an ultrasound and you look at the ovaries, like how many follicles can you see? And it's just the similar concept to what we were talking. How many marbles can you see in the bag? And if you can't see that many, you're starting to make that transition because they're literally not visible.
Mhm.
And then here's this symptom. And again, like not enough symptoms here, right? Like between the 4 of us on this call and the 3 of us here who we know are in perimenopause or now experiencing it, like there's likely a lot more symptoms. And so again, this is not sufficient, but I think does start to answer like what's normal and what's abnormal. Like this is normal to have amenorrhea and to be completely irregular and to start to have hot flashes even before you're menopausal. And then when you're menopausal, you know, the issues later have to do much more with UTIs and vaginal dryness than they do with hot flashes, though hot flashes can last like 20 years. So I think that's some of the basic concepts around
Super helpful.
menstrual cycle and perimenopause and menopause that hopefully frame some of the conversation.
Yeah, no, thank you so much. That was super helpful. And I know I went in with a good and bad, good versus bad period. But actually, I want to talk about on the last chart that you show was hot flash. And I mean, there are so many, as you said, there's so many other symptoms. So hot flash is just one of many. So, and I think that's something that we all want to make sure that our women in peri are educated. Hot flash is one of many symptoms that we can experience. Start with common period changes in perimenopause. For me, it was shorter, lighter. Growing up, experiencing PCOS, I did experience irregular cycles until I was on birth control forever. And then in my mid-30s, I decided to come off and then try to test what my body was capable of. But then in the sort of entering peri, shorter, lighter. But would love to just understand from your practice and seeing patients, what are some common changes that women experience in perimenopause? Do you see more of like someone like me more common, or is it like all over the place? Just want to understand what are the changes that you've seen in women in peri?
Yeah, so I don't do actually perimenopause and menopause care. So I don't have a huge clinical practice around this, but I can just say in terms of being in this space for the startup world, and then also being in this space myself and having a community of women around me, it is not uncommon to have the shorter cycle length at all because you do have less follicles, and so it can definitely get shorter. Also, it can just be dysfunctional and take a lot longer for those follicles to build up the necessary hormones and communication to actually ovulate. So it's really that first half of the cycle that's different between women, and then also different depending on where you are in your reproductive lifespan. The second half of the cycle is pretty regular. So between ovulation and menstrual onset, the second half is usually about 14 days. And that's kind of like true across internet, like race, ethnicity, like, age. The second half of the cycle is not variable. And then the first half of the cycle is more variable. And so I think, if you were starting to experience changes, shorter versus longer would both be normal.
Gotcha.
Yeah.
That's helpful. I also actually met a woman too. She was in her 40s and she actually started experiencing like heavier bleeding. So she's like, what happened to me? I have to like wrap myself around with like a sweater when she's like traveling through the airport. And she's like, I'm like, travel all the time for work. And now it's becoming very uncomfortable. So I definitely spoke to people who are on the other side of the spectrum, which is heavier. But then like, is there a certain point where you do need to go check with the doctor, because really heavy bleeding perhaps is not, to your point, normal. But if you don't feel normal, then you also have to, really call up your doctor and, schedule appointment to get it checked, because I think any changes should be alerting. That's why I think it's important to keep track of our sort of cycle pattern, right? How we feel about the loads and, like heavy, light, longer, shorter. So, yeah, I do the very caveman way of just like writing it down. I know people use like apps to track those. um, but yeah, sorry, do you want to say something around
No,
that?
no.
Okay. Um, so I know that we're talking about women in peri, and I guess one of the unique thing about women in peri, unlike the women in entered menopause, and that's one day, by the way, ladies, one day of menopause. Menopause means you have not had your period 12 consecutive months, and then we live in a post-menopause world forever until we die. So what are some of the do you I know that you don't do like this as a particular like practice, but just kind of understanding like what are the kind of things that you tend to teach and your patients about period care, meaning there are certain like diet, there are certain movement, there are certain things, I don't know what it is, from a lifestyle perspective, that you recommend people to incorporate. Of course there's always like Advil, but just kind of thinking, what else do you tell people to consider to help with their pain that they're experiencing?
Yeah, so I think that the one thing that your reproductive life cycle, when you're cycling regularly and you're not in perimenopause, that you can take for granted is that your body is flexible and versatile. You can like stay up all night and not be exhausted the next day when you're 23, the way that you can't do when you're 43. And so when you're in that regular, more like cycling time of your life, obviously diet and lifestyle and things are important, but your body is much more able to sort of, it has a lot more reserve. So as you do things in your life, your body can accommodate those changes. What I would say is like, my friend just had a baby, right? And I was giving him advice and I'm like, with the baby, the baby's like 5 days old, but I'm like, at some point you start with the like pre-bedtime routine and you do the bath and then you put the lovey and you do the, and you do this to help the baby start to get into a structure. And so when you have a body that's not functioning as well, this is why you start to understand like why old people are like, well, I always do this thing. And I'm like, I never used to understand like, why are you so inflexible? Like I always have this at this time of day. And it's like, well, if you don't set your body up for success and give it some structure to work within so that it can function the best that it can possibly function, like you're not setting it up for success. And so, I mean, it's pretty basic stuff around like setting up a functional structure. And this is true at any point in your life, but certainly when you start to experience the things not working as well, you need to do your best to optimize the circumstances in which your body can function as well as it possibly can. And so like, it's all very obvious, like what those things are. Like, just think about it in terms of hormonal signaling and like what your body needs to have proper hormonal signaling. Like it needs the right nutrition. It needs the right amount of sleep. It needs to be optimized in terms of exercise. It needs to be optimized in terms of like the body weight's relationship with fat stores that are hormonally active. So, without getting like particularly specific, it's like, what makes you feel best. Every person absolutely knows what they need to do, what they should do, and also like what actually makes them feel best. For me, like I really need an uninterrupted night of sleep to feel good. It has to be uninterrupted. So like I have to stop drinking fluids at 7. You become an old person because you're like, I have to stop drinking water by 7 p.m. or like I'm going to wake up in the middle of the night and then be tired the next day. So I think it's just optimizing the organism, setting it up for success, giving it the things that it needs to be able to perform properly, which is like, don't put all the bad things in there and do the bad things. Like try to do as much of the good stuff as you can. And what makes you feel good. So, obviously Nabi has some products around that, I'm sure. And WaveBy also has products as well. But as you said, like, I think setting up the context, creating the garden in which you can grow from is really the best that you can do. And, there's vitamins that you can take and things like that. And so you definitely want to optimize, but I think people know themselves, or they need to start to pay attention, know themselves, what makes them feel good, what when they eat something, what doesn't make them feel good, don't eat that thing if you can help it, you know?
Since you've done a lot of research around period pain, kind of curious if you see any relationship between period pain and sort of emotional stress, emotional and sort of mental stress.
You know, I absolutely love that question. I actually wrote a proposal for a grant specifically around that question. As you mentioned, like we do have a product, our products reduce period pain statistically significantly based on literature. And so what I was interested in was, if you reduce pain, what is the impact on mental health? And so we sent out some tester packs because we're still pre-launch with our products. But one of the questions in the survey is asking specifically around mental health, because I did want to see if you help take care of some of the symptoms, how does it impact mental health? You're not dealing with pain, and pain is exhausting. Pain is exhausting. So, yeah, I don't know, like that, you know, there's not a lot of data around the mechanism of action if your medications could actually help impact that mental health, but it's certainly an area that I am interested in researching on behalf of Wave By.
Yeah, good for you. There, we do need more research for sure. Um, I want to talk about people who are already kind of growing up experiencing PMS, PMDD. I'm not sure if you've seen anything or heard anything kind of how they, when they migrate to perimenopause, like does that carry on, or does that more of a change happens as well to people who are like feeling the severe pain?
Yeah, so there is definitely a change in mental health with perimenopause and menopause. Just the reduction in estrogen that's around really increases the risk of depression, and it also increases brain fog. If you're talking specifically about PMS and PMDD, you know, I think it's like the hormones is just not predictable, the level and amount of hormone. So I could see that, like, if it was enough on one cycle, you know, you might to feel a little bit less bad versus another cycle where the hormone changes are just so drastic that you just feel so horrible. Um, you know, people have asked me before about like cycle syncing, and I'm starting to do some research, like education of myself around cycle syncing. And aside from what I'm reading, my own opinion is like, I could give the birth control that I'm on to all three people on this call, and everyone is going to have a different symptom profile for their cycle. And so I just think like how people respond to hormones and how people respond to hormone changing is, to me, it seems pretty individualized. And it's also just like so many data points, right? It's like you're in a different cycle. You could be in a completely different life stage. You could be on a different time zone in the next cycle. You know, like all of this stuff is just so hard to generalize like across a population that, like, you know, you're going to get worse, you're going to get better. But obviously, as there's less hormones around and less fluctuations in hormones, things are probably going to stabilize. So, you know, you may have more depression in menopause, but it's going to be more stable depression that you can treat, as opposed to this time where like the fluctuations just make it really hard to predict how you're going to respond.
Yeah, I think that's what makes peri very difficult, this erratic, unpredictable fluctuation hormones that makes us feel very upside down, sideways. So it gives you a bit of a headache, like you're in a roller coaster. Um, do you mind explaining it's the difference between the PMS and PMDD? Just I want to, for people who are listening, to just understand what the difference is.
Yes, so I don't have the definition pulled up in front of me, but the premenstrual dysphoric disorder versus premenstrual syndrome is like you have to qualify, you have to have certain criteria that you qualify for.
Okay.
And so I can pull that up and read it out to you, but it's just a much more severe form of PMS where you are really struggling with, you know, those symptoms, and there's certainly treatment for it too. Like there's actual medications that you can take cyclic medications. You can do therapy and things like that. But PMS is sort of like, as hormones are changing. You're just experiencing like all of those premenstrual syndrome that like everybody knows how they feel the week before the period. But premenstrual dysphoric disorders, like it is really profoundly impacting your quality of life. And has like an actual definition of criteria.
That you have to meet. Yeah, I only asked that because I think that now, especially the younger women, I think they are very into checking their cycles and tracking, and as a result, they're also really understanding kind of what is difference between PMS and PMDD, and then we do also have some NABI customers that are kind of dealing with that. So I was just kind of curious and defining it for the people who might be listening this. And another question that I have before coming into this, somebody was asking about during perimenopause, because the cycle could be irregular. And in order for us to kind of qualify that menopause day, which is we have not had our period 12 consecutive months. Until then, we might have some spotty, cycles, right? So what it may just kind of understanding what might be a difference between hey, I'm having an irregular cycle because I'm in peri versus, oops, I might be pregnant. I'm not sure if you know if there's some insight that you can shed, but there was a bit of a conversation with a group of women about that. So I wanted to bring it up and see if you have any thoughts and reaction.
Yeah, so the menstrual cycle, all of these things, like again, if you go back to the fact that it's communication in your body and your body's sending out signals, you can imagine that if you didn't set up the right framework that month, those messages are going to be a little bit deranged. So even if you're not in perimenopause and you're in regular cycling, reproduction, like there's variability between cycles. You traveled a lot that month. You were super stressed out about something. You had a major life change. You know, women who really get to know themselves, like one of my best friends in med school, I mean, she would just be like, oh, my cycle is different this month because, and she could pinpoint like why the reason was. And she was very focused on her menstrual cycle. And so you can have variability across the lifespan, regardless of if you're cycling because you're not in perimenopause or if you're in perimenopause. But like, did you have unprotected intercourse in like the last 2 weeks that could have put you at risk for pregnancy? Like, if you have, you should always have a pregnancy test around. I mean, there's certainly many times in my life that I've just taken a pregnancy test because I expected the period and it didn't come and it was negative, but it was probably just a crazy month, or I was on call a bunch and I was awake all night and my body just couldn't handle all those changes in steroid hormones. And I was getting older and just couldn't bounce back as quickly. And so it affected the menstrual cycle. And so I think obviously everybody should do as much as they can to practice safe sex, which includes like preventing, sexually transmitted infections and preventing pregnancy if it's undesired at the time. And so you should care about your body enough to have some plans and goals around that if pregnancy is not your goal at the moment. But like, whatever, if there's no shame in getting pregnant when you didn't mean to, just go take a pregnancy test. It's not the end of the world. It will make you feel less anxious. And also just know, like, it could be up to 60 days between cycles. Like it just starts to get really irregular and really starts to pace out. And that would be that late perimenopausal phase of the cycle. And you'd be getting close to menopause. By the way, again, I hate the definition that menopause isn't a period in 12 months. Like that doesn't mean anything. Like, why is that the thing? And why is that the definition? And there's some more research now around AMH and testing AMH, and over a certain age, if you test a hormone that is produced by the follicles in your ovaries, if there's not a lot of follicles left, that hormone is not very high, and it's getting better at predicting when your actual final menstrual period will be. So I think hopefully we'll have some much more objective clinical measures of menopause besides like you haven't had it in a really long time. Like that just doesn't sit right for me.
My last question, I want to, then Marina and Sonia, maybe they may have questions. So heavy bleeding. So this may happens during perimenopause or maybe not. But generally speaking, if somebody's bleeding quite heavily, what are the scenarios that might be causing that, like potential scenarios?
Yeah. So again, like this can happen throughout the lifetime and not just in perimenopause. There's a whole like abnormal uterine bleeding sort of workup and consideration. Like it could be something structural with the uterus, like you have a fibroid. It could be, you know, an abnormal growth of the uterine lining, like a polyp. It could be that you have more of a PCOS like picture in your life and you're just going so long between periods that you're building up like excess lining. It could also be that you are overweight and that, you know, extra adipose tissue is producing more estrogen and building up a thicker lining. So heavy bleeding or bleeding that you think is heavy or that has changed from your baseline, it really does start to matter around age 45. So that's usually when it's recommended that you get an endometrial biopsy to make sure that it's nothing more serious than perimenopause. But like for your friend who's having heavy bleeding and it, you know, it's really changing and really impacting her quality of life. You know, if she's over 45, she should probably get an endometrial biopsy or probably get an ultrasound. She like probably should go in and make sure that everything's okay, because that's changing quality of life. It's not like, oh, I used to have 5 days, now I have 7 days, but it's manageable. I mean, you made a motion like she's tying a sweatshirt around her waist. And that to me is like, that is a clinically significant change for someone. It's impacting their quality of life and their behavior, and like probably should just be evaluated.
No, that's fantastic. I also like what you said. It's about how you feel, because I think women try to advocate for themselves, but the whole gaslighting thing is real, right? And then they get shut down and say you're too young, for example, for perimenopause, but perimenopause actually happens in mid-30s. So things like this. So if you are feeling off, we tend to say at NABI, like, then you're off. So acknowledge it, right? So, well, thank you for bringing that up, because yes, you measure like, was it 3 days versus 5 days, but also it comes down to like, are you feeling like normal or not? Are you feeling off? That's a really good indication.
Well, also your
Mhm.
friends, right?
Yeah.
Like she told you something, and so it's scary enough to her
Oh yeah,
that it's
totally.
getting outside of her own head. And she's
Hmm.
asking other people, like, this feels not right. Is it not right or right? And it's like, well, it could be normally abnormal, but like if you're scared, go in and instead of saying, like, I have heavy bleeding and letting someone blow you off, say, I used to have this. Now I have this. It's impacting my life in this way. I'm using this much product. And that framing it in a way that a doctor can hear, that's objective data, is going to decrease their likelihood of gaslighting you, because you're not giving them a vague symptom. If someone gives you a vague symptom, the doctor honestly gets scared and doesn't know what it is and doesn't know what to say. And so they just brush it off. And that's what gaslighting is. It's actually not a doctor like not believing you. It's more a doctor not knowing what to do
Knowing.
with vague information. And so if you can go in with not vague information and very clear information, and you can say, look, I'm like at this point bleeding through my pants at the airport and had to buy new clothes, and I've never had anything like this in my life, and it was 3 months between my cycles. Well, it was 3 months between your cycles, so that was probably a crazy period because it was building up for 3 months, versus it wasn't 3 months, it was 1 month like regular, and then I had this crazy hemorrhage. It's like, well, what else changed? You know, are you taking hormones? Did you change your hormones? Did you take out your AUD? Like, do you have a multifibroid uterus, and maybe the fibroid's getting closer to the surface of the uterus and it can't contract, it can't stop bleeding? It's, you know, there's like a lot of issues that can be evaluated. But to me, like the sort of take home message of that question and that circumstance is like, just quantify everything. If you go in with something quantified and not vague, someone can't be vague back.
I love that. No, thank you. That's powerful way to like put a statement and put a period. Marina, Sonia, do you guys have any questions?
I would love to hear about, just if you had to build just a timeline of what periods usually, because we've established that, normal is different, it looks different for everyone. But if you had to, define what a period would look like in perimenopause, from early perimenopause to late perimenopause, if you could describe a bit of that timeline from like the period experience perspective, like what that would look like.
Yeah, so what it looks like is just broken communication. So it's broken at the beginning when it's starting because it's calling out to each other and it hasn't figured out how to call out to each other effectively. So when you're getting your first periods, the brain is calling out and saying, I'm changing, and the ovaries haven't woken up yet, or one of them woke up, or one of them made a crazy cyst because it didn't know what it was doing. So it's definitely broken, irregular at the beginning. It's very hard to diagnose like polycystic ovarian syndrome in teenagers because the teenager time frame is just so irregular. So it's usually about 3 years at the beginning where it's super irregular. Then you start to get into your own pattern, and your pattern may be very irregular because you have PCOS and you probably should be evaluated and get treatment. But sort of in that middle time frame, you're going to have some sort of regular for you. When people get pregnant and then postpartum, it can be very different as well, depending on whether or not you're breastfeeding, how you're breastfeeding, and it could just be very different. Women can have a very different period experience postpartum. And especially since we're starting to have babies later, the average age of birth is like 31 now or something in the US, right? And EJ is exactly right that people essentially are in perimenopause starting at 35. That's the other thing, is like, I don't know why perimenopause is a scary word. Somehow it's a scary word, and somehow people are a little embarrassed about it. And it's like, you're just in it. That's just it. You're 35, like you're perimenopausal, you're perimenopausal, we're all perimenopausal. So like, it's just this menopause word that there's so much taboo tied up with being insignificant or losing value or something like that, or that we're also afraid of. So like circling the menopause with perimenopause becomes this like negative thing. But it can be very confusing if you're having babies between 31 and 35, 37, 38. And then when you come off, you're basically perimenopausal. So again, like, as we can remember from that chart, the early perimenopausal time is just a difference that can be a little bit different, but doesn't have to be crazy different according to their definitions. It's like 7 to 9 days is normal difference, variability between cycles. Once you get beyond that, you're in perimenopause. Once you get to like 60 days, you're in late perimenopause, and you're starting to, get closer to that menopausal time frame. So I don't think it's that easy to predict, but I do think one way to think about it is like at the beginning, it's just turning on. You're trying to learn how to work your stick shift. You're getting smooth, and then you figure it out. You're driving, you're doing great. And then like the marbles start to fall out of the bag, right? Or the gas tank begins to empty, and then the car, like, it's a little harder, or you're on a hill and it's harder to start the stick shift. Sometimes it revs great. Sometimes you stall out. So I do think the perimenopausal time frame, it's just really important to think like sometimes the messages are well received and sometimes they're not. And all of the symptoms are just coming with worse signaling as well as reduced, receipt of those signals. So I don't know necessarily that you can just say anything, except the time frame is probably going to start to spread out.
Yeah, I think it's I think this is also a reason why, like, us sharing each other's stories, I think is helpful, because if we learn the data collection part you're talking about earlier, it's not really out there, especially like when we talk about perimenopause is something that we are now hear more. But when we started this project 4 years ago, I mean, it was like a vocabulary that people were not really accustomed to even say. So I think the more we share, more we talk about different symptoms, and period change is indeed one of the key significant symptoms in perimenopause. So really paying attention to it, and it could be you're in peri for like 7 to 10 years. So that's a quite long time if you don't know what's going on. So we say, let's educate ourselves and ask questions. And to your point, like quantify what you're feeling, and try to articulate what you're feeling, so that it's not like I'm feeling off as a starting point, but then how are you feeling? And, that's the way for us to self-advocate for our own health and well-being. So, well, on that note, thank you so much for being here. And, the period talk, I mean, we can probably talk about various period pains in many forms, but we'd love to, stay in touch. And yeah. We'll let you know if there's any other specific question from our community. But thank you. Really lovely having you, and thank you for your time. And thank you,
Thank you,
Sonia, for
guys.
joining.
Yeah, that was amazing. It's great to connect with you before and continue to connect with you guys and be part of the same community and to have a chance to talk about this. So, yeah, we're all on the same team, and we're here for each other, and we gotta support each other. And like you said, EJ, when your friend tells you something, start to speak up yourselves and for each other and to each other. So,
Yeah, all about, women empowering women. So we're into that. All right, Margo, thank you.
thank
We'll
you
talk
guys.
soon.
Have a
Thank you,
wonderful day.
Dr. Harrison. Thank you so
Yeah,
much.
it was a lot of fun. Thanks so
Bye.
much. Bye.
Bye.